talk to your vet about your pet, because at the end of the day, your individual circumstances are way more important than what a study shows. You may be in a situation where these things will never happen to you, but the thing I always worry about is someone will just look at the title, they'll look at the abstract, and they'll just say, well, I'm not gonna neuter my dog before the age of 12 because this study said that it'll definitely have an ACL tear. And let's also talk about, like, what does that mean for the general public, where we have shelters that are full and accidental litters. I always worry that these studies in the wrong hands are going to have really bad unintended consequences for the general population.
Hey, I'm Dr. Kara, the host of the Pause and Effect podcast. This podcast is all about bridging the gap between pet owners and pet professionals, offering expert insights and sharing stories to help you better understand and care for your pets. Whether you're here to learn, to be inspired, or to simply feel more confident as a pet owner, you're in the right place. If you enjoy what you hear, please take a moment to subscribe, leave me a review, or share the episode with someone who could benefit. Your support helps this podcast grow and continue making a difference in the lives of pets and their people. Let's get to it. A very, very warm welcome to the Pause and Effect podcast. Thank you so much, Dr. Deer, for joining me all the way from Arizona. Despite the fact that we're on the same master's course, we are obviously very, very, very far apart. We're doing it remotely.
Oh.
Yes.
Yeah.
So
I didn't realize you were in Glasgow too. That's so cool.
No, I'm not. I'm all the way in South Africa. So,
the Glasgow's master course, right?
Yes. Yeah, I'm also doing the Glasgow master's course, yes. So, I mean, this is the beauty of technology these days, that we can remote interview and discuss. But apologies, because I know it's very early in the morning for you. It's now approaching 4:30 in the afternoon for us. So a very warm welcome. And thank you for agreeing to chat to me. Like, it's what you're doing. I think it's really relevant for my listeners who are pet owners and pet enthusiasts. And that I wanted to talk to you today about what you do a lot of. So obviously you're an emergency veterinarian. You're an author of a book. I'd love to listen and hear a bit more about your book. You're doing a master's in animal nutrition, which is very cool. Mm-hmm. That's a very common interest. And also you're an emergency veterinarian and traveling veterinarian. Mm-hmm. So I'd love to hear, what does that mean? So start with your day job or your night job. What is the work that you're doing involve?
Yeah. So there is a really big need for emergency veterinarians in Arizona. A lot of clinics are not really well staffed. So they basically just, send out, they have a kind of relief doctors, and they send out their schedule and they're like, hey, can anyone fill in these gaps? And so that's what I do, is I fill in the gaps where people are on vacation or maternity leave, or maybe they just don't have the full staffing.
Oh, that's fantastic. And your interest, what book did you author? What have you, tell us more about your book?
Oh, yeah. So on the side, I'm a self-published author. So I have several books kind of all over different genres. I've got young adult, romance, just kind of, everything as a fun side gig where no one knows I'm a veterinarian. So
you can take on a different persona.
Mm-hmm.
And so I obviously came across you on your social media platform, being Instagram, and you're doing a phenomenal job out there, dispelling a lot of myths and managing misinformation that we have and that we tackle with obviously every day within our consult room. So I wanted to take the opportunity really to discuss that and discuss why the need and what are the common things that you're tackling and the kind of response that you're getting, both positive possibly and negative, and how you handle that. So firstly, let's chat about your Instagram page and introduce us to why you started doing what you're doing.
Yeah. Gosh, it was during COVID, 2020. And I had to deal with a lot of misinformation at work, and then also just kind of scrolling on social media, on TikTok and Instagram. I would see these things where I was like, this isn't accurate. And I know for a fact, because this is my field, this is what I do for a living. And there just wasn't a whole lot of voices to the contrary. And so I was like, well, why not be that voice? I had a history of being on social media. I used to be a competitive bodybuilder and power lifter. And so I had a social media presence with that. And during that time, I had also used like looking at studies about like nutrition and fitness to kind of like guide my own path with like with nutrition and fitness. And so it was just like very natural for me to be like, oh, I should just do this in the veterinary scope too. I kind of had that idea that like these voices are loud, but I could be louder, and I have this unique ability, or not a unique, but I have the ability to kind of look at these studies and say, well, this is why we do what we do, to give that context.
Absolutely. I think that's really valuable. I mean, when I speak to veterinarians, particularly those that have published in journals, or we are naturally critical thinkers. I think that's often generally why we've gone into what we do, but we are also trained and we're developed to think like that and to take information and try and disseminate it into often information that we can pass on to pet owners, but also, is this true? Is it factual? Are there any other compounding things happening here? And then, we don't take it at face value, which is quite tough, isn't it? Because sometimes when you're receiving information that's different, you actually take it on and you go, like, have I missed something? Is there something? And maybe we'll take a few examples of this, but have I missed information that's now like actually compounding or or totally different to what I have been taught, or I've gone through vet school, and maybe I'm losing touch and I'm just not staying up to date. And one of the things that you do that I love is that you will take current articles and you will tackle it and you will make it very practical, but appeal to people who need it the most. And that is the pet owner. So how are you finding that that's resonating with people? Are they, you can see from your following that people really value the work that you're doing.
Yeah, it's definitely been interesting. And I've kind of like polled my audience a few times to see who they mostly are. Because when I started, my intention was to like myth bust for the general public, to talk about like common things that I see in the ER and like how to not end up in my ER. So to me, that felt like something that was very like pet owner focused. But anytime I've pulled my audience on like Instagram, for example, it's been like 75% other people in the veterinary field, which is really interesting because I know I have a lot of pet owner followers who are very dedicated. And they want to know the latest research and studies. They are following nutritional DCM very closely. The recent wave of like spay neuter papers, they've been really interested in. And so they kind of, I think they want that. Okay, let's have someone look at this information and see where's it coming from, what pearls can we gain from it, and not necessarily be in the veterinary field, which I think is really interesting.
Absolutely. And that is a great example of some of the information that's coming up that we need to reassess. There are changes and progression within our profession is just at a dramatic rate, particularly now with AI and, the continuous professional development that we have to do as veterinarians is extensive. But we have to be able to change our minds if that's what it means for the interest of the pet. So let's talk about some of the misconceptions that you've come across. What stands out for you in terms of some of the things that you've gone, I need this information out there. I need to dispel this myth.
I think a lot of it really started with food, especially, the animal food space. There were some very loud voices, and there still are some very loud voices that feel very strongly that veterinarians have some sort of financial tie to pet food companies. Somehow there's a myth that both we get no nutrition education in vet school and that our nutrition education is paid for by, one of the big three, which I always found kind of interesting from like like you were saying, critical thinking standpoint is, how can both of those things be true? How can we learn nothing about nutrition, but also all of our nutrition is paid for by these companies? And so that's kind of where I started with, okay, well, let's talk about that myth. Like, let's look into who does donate to schools. What do school budgets look like? Because that made the most sense to me to say, okay, well, let's go to the source of that and say, where do schools actually get their funding? Because I know that we would have like lunch and learns, for example. But as a broke vet student, I was going for the lunch. And yeah, it was great to learn about these products and everything. But at the end of the day, it's not like my morals wouldn't trade a soggy salad to pump animals full of or, whatever the case may be. And it always kind of made me drawn to question the people lobbing those accusations, because I was like, well, I would never assume that someone would give up like their own moral, ethical standpoint and recommend things that they don't actually believe in for like a sandwich. And so that seemed really telling to me of them, because they seem to think that there's people that would do that, which makes me wonder, how easy is it for them to, how easy are they bought? And so that's kind of where it started, was, okay, well, I can talk about this from a very personal standpoint. And then it became, wow, you should really focus in a little bit more about the specific nutrition myths, the, just all the different things like, oh, the stuff that's in pet food is also in tarmac, things like that, where I was like, okay, well, I've never heard that. So I can't really, like you were saying, am I behind? Is there some sort of research that I'm not understanding? And I find that a lot of the misinformation starts from a kernel of truth that's either misunderstood or intentionally misunderstood in order to sell something. So that's kind of where I started going, is let's go back and find, where was this information originally shared and what was the motive behind it? And that made it so much easier to look into like where that misinformation came from and to dispel it, because you can find that kernel of truth and you can say, well, this is where it started. This is what actually is going on. And then be able to kind of meet people at their level and say, I understand why people thought this, but with the information we have, it may not be 100% accurate.
Hey there, pet parents. It's Dr. Kara, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. Absolutely. And I mean, I agree. I mean, I'm obviously long qualified, and I will have, that's because you're making money from these commercial products. The fundamental take home for anybody who's listening is, I can sell whatever I want and make money from it, but I'm not going to do it if it doesn't align with my principles. So I'm going to come out and say it, because my listeners know that I'm not a raw food advocate. I've undergone a chemistry degree. I have a first-class degree in chemistry. I then went on to vet school, and I'm still looking for information that changes my mind. So I'm always critically analyzing information that I'm receiving. And I would, in some respects, like to have someone change my mind, but I still, everything that I receive and every bit of information I take on makes me go, okay, absolutely. If your pet has a problem with X diet, let's consider something different. I've got enough of an interest in animal nutrition that, like you, I'm undergoing the taking the time to take it further and qualify in animal nutrition. So it's like my interest is there, and to have people go, it's because you're making money from other products. I'm like, well, I can sell raw food. I can sell raw food. I can make money from selling raw food. There are enough people out there.
Way more money.
I know. So it doesn't really align. And I find, unlike you, I find sometimes it's very difficult to dispel some of that misinformation out there, that I actually go quiet on it. So how do you tackle things when people just come back and they just have a blinkered view about something and they don't want to get an explanation, and maybe rightfully they don't want to change their mind?
Mm-hmm. Yeah. And, I think I share a lot of the same beliefs that most veterinarians do, in the sense of, I can only tell you what my educated opinion is. And if you don't want to take it for whatever reason, that's something for you to deal with, not me. And so, I will have people who are in my comments who feel very strongly and will kind of hound on things. And after, when it's obvious that they're just there to preach and not to like have a constructive conversation, usually what I say is, well, it sounds like, there's this conversation is not really fruitful. It's not serving me. And now I see like the comment notification and I'm like, ugh. And it's like, okay, that's where I just say, well, we disagree. And then I just leave it at that and just basically say like, maybe one day something will happen and you'll change your opinion, in which case, welcome you back with open arms. And if they continue to like dig and pick, or they're harassing people in my comments, I just block. I'm not dealing with that. My social media is my social media. It's not attached to a clinic. It's not a business. I'm not a politician. I don't have to deal with that. You know what I mean?
Absolutely. No, I mean, I think, I ask you this because you're human. And I think sometimes you put things out there and I get it with my social media and I see it with yours, that they speak to you like there's not a person behind it. That people can be so insulting behind a comment or a message, and it's not really achieving anything. But does it have an impact on you? Does it, or have you just toughened to it?
No, I have really thin skin. I'm actually very sensitive, and so I've realized that I have this, I guess like fear of being misunderstood. So. And that's kind of where all of this kind of started, is to talk about, you see these posts and you're like, well, that's just so untrue, and then you get kind of like, why would you say that? And that's where it started. But I definitely find that when people will say something, I'm like, oh no, you misunderstood me. Even though that's not really the case, but in my mind, it's like, oh no, I need to clear this misconception about myself. Like, I don't do that. Maybe there are one or two veterinarians or whatever that do that, but I don't. Like, why are you accusing me of that? And so it's hard not to have a thin skin with that. So I have to be, when I talk about certain topics, I have to be in a space where it's okay to do that, and be ready for the like inevitable, it's the same 5 talking points over and over and over again. And then it gets frustrating because I'm like, I already did the work in dispelling this myth. And like, who are you to come into my comments and leave a drive-by like animals, saliva is so acidic that it breaks down all bacteria. And I'm like, what? I've already talked about that multiple times. And then I get like kind of
frustrated. You missed that one in that journal.
Like, check my highlight. And they're like, no. I'm like, okay, well, I can't help you then. I'm not going to type a 17 paragraph with my sources cited about why we've already disproven this. And I think that's where a lot of my frustrations come, is I'm like, I already talked about this. I already did this.
But are you finding that you're needing to repeat a lot of the information? So some of the myths that you're having to dispel are, you've got to just, because you're obviously getting an increasing following on social media, and those new followers have not necessarily had access to or they haven't taken the time to go through your historical content, that you need to maybe approach it in a different way. So when you tackle the same myth, do you try and tackle it in a different way so that perhaps you can explain it to people who may not have understood or chose not to understand the first time?
Yeah. And again, it just comes down to like where I am mentally. So sometimes I'm in a space where I'm like, oh yeah, I would love to make 5 videos about the common myths in pet nutrition. And I'm like, okay, let's do this. Let's hammer them out. And then I have them ready for the inevitable question that comes up next. And sometimes I'm like, not today. I'm not doing it. And I'll just save it in my like drafts so that I can come back to it later when I'm like, ooh, I feel like I can tackle this topic now. But I do try and do like highlights and playlists so that I can say, oh, I have an entire playlist on why I personally don't recommend raw feeding. And I've been thinking of updating it with more, I don't want to say anecdotal, but like personal experience. Because one of my like first critical cases as a intern, when I did my internship, was a raw fed dog that just suffered awfully the consequences of its raw diet. And that really, I think, framed my, like, why I feel the way I do, is I saw this like awful case. And, I'm very much like, stick to the facts. But sometimes I think people need to hear, like, here's my personal experience and why it affected me so deeply and how these, poor owners felt. And then I've had several like people in my comments who have said that they contracted a foodborne illness from their dog that was raw fed, and they were able to trace it back to their dog shedding it. And they had to have like part of their intestines removed. And I'm like, well,
Wow.
these are stories that should be told, absolutely, because they kind of go hand in hand with that, studies.
Absolutely. I mean, and those are the kind of things that nobody really talks about.
Mm-hmm.
No one's going to talk about their gastro. So in terms of the other myths, I mean, let's talk nutrition, because obviously we both have a common interest in nutrition. What are the other myths that you get frustrated that people don't understand about, feeding their pets, particularly because we only have them for
I talked a little bit about vets being bought by
you want to try
companies.
and
oh, sorry, you broke up, and I
okay, so that one
I missed you. Yeah.
No. So my question is, like, what are some of the other common myths that you've had to dispel about pet food, other than obviously the raw food and the impact of bacterial risk and contamination of that food? What are some of the other ones that you find that people are just not accepting?
There is still a large portion of people who think that nutritional DCM is invented, it's fabricated, that the lawsuit against Hills and some veterinary clinicians is like very just. And so I find, very often I'll talk about things and they'll be like, and I won't even mention a pet food company. And I'll be like, there are certain ones that are WSAVA compliant, that have boarded nutritionists, that have years and years of feeding trials. Like, that's really where my mind goes, is the best option. And they're like, well, they're being sued. I mean, you can sue anyone in America. That doesn't really mean anything. And so kind of talking about what the lawsuit alleges, and then also how scary is the precedent that you can just sue researchers because you don't agree with what they're saying. And is that really something that we want to be doing in the medical field, veterinary or otherwise? And so that nutritional DCM, I feel like every time there's a new study that comes out that I cover, it goes pretty far. And there are plenty of people who like to say, well, this study says that it exists. And I'm like, okay, well, let's look at who did that study and what information they were working with. And let's go back to the lobbyists and who lobbied who. And, they love to say who funded that study. But when suddenly it's a company that's paid millions of dollars by people who grow pulses, it's an okay study. So that's a big one. And then the vets being owned by pet nutrition companies is another big one. Those tend to be the most common. And then I fall a lot into I see a lot of the like cats should only eat wet food. And it's kind of disappointing to see that there are some veterinary colleagues that perpetuate that myth, that animals live in states of constant dehydration if they're on dry food.
Oh, wow.
Those are some of the smaller ones that don't happen as often, but I do find them happen, on occasion, especially because we have some colleagues that seem to feel that way despite being, given evidence to the contrary.
Very interesting. So, I mean, obviously some of the myths are being perpetuated by people in our profession, hopefully by not understanding rather than, again, we'll go for they're invested in something else. But I think it's just what you're being exposed to. I mean, like if you have enough cats that come in and they're on a dry food diet, and I think it's normal, but you've got to keep updated. And I think this is where you are really good in saying, okay, well, let me look at why that is. I want to understand more so that I can be treating my patients better. So, I mean, the work that you're doing, obviously, in emergency medicine and critical care is stressful. How, on top of what you're dealing with on social media and the backlash sometimes that comes with being in the public, how do you cope with both sleep deprivation and the stress and burnout?
Having a hobby that has nothing to do with veterinary medicine. So that for me is my writing. I also love doing like yoga. I love going for walks. So the only thing that like really kept me going in vet school was the fact that I had a hobby outside of veterinary school where I hung out with people who are not veterinarians. So, you hang out with your classmates and it's all about the test you just took and, just school, school, school. And so when I was in like the bodybuilding and powerlifting community, they were talking about like what brand of creatine is the best and what's the next competition and how are your lifts doing? And because they had, varied interests, it was also like, there were other things that we did when we hung out. And so that's always been really important to me, is to have like a separate thing that does not touch vet med at all. And for me lately, that's been writing. So I have, a pen name. People don't know I'm a veterinarian unless I say it. I have a completely different social media account, which every so often people will comment and be like, is this Dr. Deer? And I'm like, yeah, it is. You found me. But things like that, just like that creative other side I think it's the way that I manage, because vet med is not my life. Social media is not my life. I have so many other things going on.
Absolutely. And it doesn't define you.
Mm-hmm.
So what I also enjoy, and obviously you've said that you've got probably 75% from your poll of veterinarians that follow you, is the content that you produce that is both sometimes informative for pet owners, but is funny and very relatable. You're talking about situations that we find ourselves in that you may journal about or you may write about in a story, but you also give some insight into some of the tough stuff, but some of the absolute hilarious moments that we have as veterinarians. Mm-hmm. Will you share with our listeners some of that, and do you enjoy making that content? Because it certainly looks like you have a lot of fun.
Yeah, I like to think I'm a funny person. I don't know that everyone would agree. I think I'm hilarious. And so sometimes I'll come up with these sketches or these skits and I'll tell my husband, I'm like, I have an idea. And he's like, all right. Like, he's a photographer. So he's like, I'll film it. There's actually one I was thinking about last night, and, people love to make that video about like the animal coming in that's a skeleton and it's like dying, and people are like, can you clip its nails? But meanwhile, every time I have a crib case, the techs are clipping its nails. So it's like, vet professionals, they want me to clip its nails, but like you do it anyway. So just little things like that where, I'll see something and I'll be like, I can make this a veterinary joke that is probably kind of niche for veterinarians, but I think pet owners, it does help them to kind of understand, like, we do have a little bit of gallows humor too. And so I try to pass it by my non-veterinary husband first to make sure I'm like, is this okay? Yeah.
No, some of the stuff is, one of your latest things that actually really amused me was, some of the things that we say and that can be heard when people are passing by. It was so funny. And so like, mm-hmm. I could resonate with, because some of the things that we say or that we talk about is utterly shocking. And sometimes, like you say, at least you've got someone who can moderate what you say because you have a husband who's not a vet. But we sometimes, when we're talking to our colleagues or we're talking amongst ourselves, that we say some things that are like hilarious, but and I love the fact that you're putting that out there in a comic way. So that's very cool.
I'm glad other people appreciate them, because they're my.
Well done.
Yeah, I love doing the science stuff, but I also love just like let's break this up. Let's do something funny. We can't just be study, because that's not who I am as a person. And I'm trying to let my actual personality show a little bit more on social media, instead of just being like, here's a study I read.
Yeah, but also, even some of the more serious topics that you tackle in a comic way is a great way of making it very shareable, but also very relatable. So you don't take yourself too seriously. Some of these things that, if you were precious about how it appeared or how it came across. So well done for letting your hair down and doing them, because it does resonate. It's very cool. So let's talk about some of the other things other than nutrition that you've tackled. There obviously at the moment there are some quite controversial topics that are in discussion amongst veterinarians in-house, as well as splashed all over social media and the internet. And some of them are like and we hear it when we listen to other people's podcasts or in continuous professional development. We are constantly coming across these conflicting issues. And one of them that you've tackled recently is, do you spay and neuter early? So tell us your thoughts on that and how you tackled the subject.
Yeah. And, whenever it comes up, I always ask, what is early? What is pediatric? Because I find that different people have different definitions. And so when we say, should we do a pediatric spay or neuter in a large breed dog? My question is, okay, so what is pediatric? Like, are we talking about 8 to 10 weeks? Are we talking about 6 months? Are we talking about before the growth plates close? Like, what are we terming as pediatric? Because I think that's the first step in understanding where the argument is coming from. I also have, my own personal biases in the fact that I live in an area with a high stray population. I also went to vet school in the South, where they literally send animals up north because the shelters are full and they're euthanizing animals hand over fist. And so things like spay neuter at 8 to 9 weeks is considered life-saving in some areas, because otherwise, if you're not spayed or neutered, you're going to be euthanized at a shelter. And so, I understand that I have those own biases. And so I try and keep those in mind when I'm kind of going through the data, is that I feel very strongly that most people do not need an intact pet. Because no matter how responsible you are, there are other people who do not share that. So one example that I love to give is that I had a dog come in when I was a technician, and it came in for vaccines, and they said, oh, by the way, she's acting kind of strange. And she was in labor, and the owner didn't know. A dog had jumped their fence, presumably, because it's the only dog she had. She doesn't take her for walks. She doesn't take her to dog training. She doesn't take her to the dog park. Somehow that dog got pregnant, never leaving their house. And she made a vaccine appointment thinking, oh, it must be time for vaccines, and that's why she's acting sick. And it turned out she was in labor. So, kind of seeing these studies that come out that say that you should not spay and neuter your pet until a certain age, I think that's really great for some people who are, they have working dogs. They have dogs that have these high, genetic predispositions for certain diseases, where we say, okay, do we think that spaying and neutering later in life may prevent the likelihood of things like cancer or CCL tears, while still keeping in mind the fact that there are things that are worse than a CCL tear, like a pyometra or mammary cancer. And so when we say, okay, some studies say up to like 50% of dogs over the age of 7 end up developing a pyometra, whereas, 3 to 5% of dogs in this same breed will develop an orthopedic issue. I'm like, I don't know that I care about a torn ACL when the alternative is a multi-$1,000 emergency surgery your pet may not survive. And so I try to bring that context in and say, like, as an emergency veterinarian, the things I care about are very differently than what a repro vet cares about, a GP doctor cares about, or even, orthopedic surgeons care about. So that's why I try and be very careful about, here's what this particular study showed. If you are comfortable making inferences off of 17 pets, that's fine. I just want you to know that this title may be misleading because there was only 17 pets. Or I know a few months ago, I was sent something about spay-neuter syndrome. And I was like, oh, wow, I've never heard of this. Well, it turns out this person created that term, so that's why I've never heard of it. And went down a really interesting rabbit hole about LH and like luteinizing hormone and its role in things like cancer. And, looking at these specific studies where they looked at luteinizing hormone in cancer, finding it really interesting that they picked breeds that are known for having certain types of cancer. And so saying, okay, well, can we use this as like a context? So I try to take a step back while also like coming from my own personal place of, I think this is great for individual people. I always say you should talk to your vet about your pet, because at the end of the day, your individual circumstances are way more important than what a study shows. You may be in a situation where these things will never happen to you. But the thing I always worry about is someone will just look at the title, they'll look at the abstract, they won't have access to the full study, and they'll just say, well, I'm not going to neuter my dog before the age of 12 because this study said that it'll definitely have an ACL tear. And it's like, well, it's not 100% accurate. And let's also talk about like, what does that mean for the general public, where we have, shelters that are full and accidental litters, and the amount of C-sections I do on housemates that were siblings. I always worry that these studies in the wrong hands are going to have really bad unintended consequences for the general population.
Absolutely. And I don't want to lose the opportunity to talk to you about vaccines and the concern of vaccines, because I know that like we've got the major problem of rabies in South Africa and parvo. It's one of the typical presentations on the emergency on the weekend. Tell us your feelings on vaccinations and why.
Yeah, and I think I shared recently that I practice in a very high parvo area. I think we're considered endemic for parvo. It's year round here. We have seasons, but you can get parvo any time of the year in Arizona, especially the Phoenix area. And so I feel very strongly that vaccines are life-saving implements. The other thing that I've kind of changed my opinion a little bit about is that like early socialization, because these vaccine schedules, don't leave the house, don't do this, are really great for disease prevention. And, with parvo being sometimes, some studies say without treatment, 50-50 chance of survival, sometimes with treatment, 50-50 chance of survival. But are we now condemning pets to socialization issues? I don't know if you've seen this, but since COVID, I've seen a huge increase of pets with really bad socialization that end up needing to be like almost completely sedated to just do a basic physical exam. And so that's something that I've kind of looked into a little bit, as saying that, yes, I still believe that vaccines are extremely important. I still think the puppy series, every time I diagnose parvo, I kind of die a little bit inside. But what are some recommendations that we can give to owners that aren't just never leave your house with your puppy until they're fully vaccinated? That being said, I have had kind of interesting, some of the areas that I practice in are in kind of like more affluent areas. And there are people who are a little bit more anti-vaccine. And I've been diagnosing a lot of 7, 9, 10-year-old dogs with parvo.
Wow.
And that's been really tough to kind of talk about because, we get these studies that say, well, they have titers protective for up to 7 years. I'm like, well, that's fantastic. But what if your dog's not one of those dogs, because not 100% of the dogs had titers protective, and titers only look at one side of the, immune response. So the vaccine thing, I think, is the spay neuter has kind of overrun the vaccine conversation as being like the front of people who are really, really interested in kind of where we're going in the future. And do we need to change our vaccine recommendations? But I still think it's really important to share those stories and say, I mean, I lose patients that people spend tens of thousands of dollars trying to save from parvo. We recently saw, thankfully in America, our rabies, or in the US, our rabies risk is not that big because we have such great vaccination protocols. But we just had a few months ago a puppy that was in an adoption situation that had rabies, and the whole litter had to be euthanized. A YouTube famous squirrel was just euthanized because of rabies concerns, is kind of what I'm reading on that. So it's still really prevalent. And I think it's easy to become lax, but we need to still remember that like vaccines are the best invention of the last several centuries. They've saved so many lives to the point where people can say, oh, who cares about vaccines? Like that's such a privilege to be in a place where that is. And that's only because of great vaccination that we've gotten there.
I totally agree. So I mean, we're talking about some of the common myths and generally misinformation out there. But I think what I want to understand is, why do you feel that there is so much misinformation, and why are owners losing trust in us as veterinarians or as professionals able to advise, and why they're not taking the advice?
Yeah, it's always such an interesting discussion to have, right? Like why are you trusting someone who has no advanced training, who may have taken like a weekend course? I mean, we're both in the master's program and for animal nutrition, and it's intense. It's not just like a cute little class that we spent a weekend taking and now we can call ourselves a nutritionist. It's very involved. And so it's always so shocking to me as someone who went through all that schooling, who is like, wow, if I have a question about, aerospace engineering, I'm not going to ask someone who failed biology in my, that I went to high school with. So it's always so interesting to me why we find these people. But I think what it comes down to is that people just want to do the best for their pet. They really want to do the best for their pet's health. And what happens is they find people who kind of convince them that there's a problem so they can sell them a solution. And I don't know that all of these people are doing it intentionally. I think some of them, have a dog that has allergies and they can't afford to do the food trials. They can't afford to do the allergy testing. And so they get frustrated because the vet's like, okay, we'll just take this medication. And in their mind, they hear, we're not fixing the problem. We're throwing medications at it. I've had people decline pain medications for limping dogs because they're like, well, that's just covering the pain. I'm like, well, that's the point. If you sprain your ankle, you're going to take something like ibuprofen and you're going to rest because that's helping to address the pain so that your body can heal appropriately. And so I just wonder if, people have felt on the human side kind of ignored by clinicians. Especially the way that things are moving in veterinary medicine, where your appointments are 15 minutes and you're lucky to get a word in edgewise over like the typical spiel. They see that on human medicine and they see it encroaching into veterinary medicine, at least in the United States. And then they can't help but say, wow, they don't really care. But this person on the internet, who has this beautiful setup and sounds very convincing, may have the answers that my veterinarian doesn't. And the fact is, most veterinarians don't really have the time or energy to just do social media, to have these long conversations. They don't get the privilege of working at a practice that allows them to have 30, 45-minute appointments to talk to owners that are concerned. They're very stuck. And so I do run into a lot of clinicians who are like, wow, I can't believe you talk about nutrition. Like, good for you, could not be me. Whereas on the flip side, some of our colleagues who have different views about nutrition that may not be rooted in quite as much, it may be rooted in a little bit more in like misinformation, get huge followings because they know that that's kind of like the rage baity way to get people. And so it doesn't really help our cause when some of our colleagues are kind of glomping onto these. So it's, I think if we figured out why that mistrust was happening, we could do something about it. But I think it's just so multifactorial that it's like you cut off one head of the hydra and another one grows.
So it's conflicting views as well as just apathy and burnout from our profession, not having the time and not taking the time to. It's huge, isn't it? Well, I'm absolutely delighted with the work that you're doing, and it's certainly it's helping. I would encourage anybody, all pet owners, veterinarians, to follow you and follow what you do on social media. I think it's really beneficial. It certainly helps in terms of, and you give us access to the journals or the articles that you're referring to. So it's not that you are trying to misguide or mislead anyone. People can go and read them themselves and make their own decisions about it. So yeah, both the information but also the funny skits and the comedy is a great combination. So well done for the work that you're doing. I'm thoroughly enjoying it. And thank you for taking the time to talk to me and my listeners. I think some of the stuff we've discussed today, probably they'll have more questions for us. So if they have any questions, I know that you'd be very happy to answer them. So thank you. Thank you, Dr. Deer.
Yeah, thank you. And I do try and answer all my DMs on Instagram. Sometimes they get filtered into spam and I can't help but I do try and answer all of my DMs. So if people ever want to reach out or talk about anything, talk about, the master's program or just to say hi, they're more than welcome to.
Thank you. No, very cool. You're very accessible. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.